Dr. Andreone, thank you so much for joining us here on Health Connection. The title of this segment is Preventable Foot Problems, Putting Your Best Feet Forward. You are a DPM,
Yes, sir.
a podiatrist. Explain that medical specialty for us.
Well, just like any other medical specialty, you have a 4-year undergraduate degree, followed by 4 years of podiatry medical school, followed by residency anywhere from 3 to 4 or 5 years now.
And you work exclusively on
Feet.
And describe a little bit about what, the medicine and the science of the foot. What do you deal with?
Pretty much anything foot related, whether it be a sports injury, deformity, common rashes, ingrown toenails, bunions, hammer toes, neuromas, heel pain, plantar fasciitis, Achilles tendonitis, anything foot related.
Well, related to that, what are some of the most common foot problems? What are the most common foot problems that you deal with in your practice?
Well, mostly ingrown toenails, hammer toes, bunions, corns and calluses, some sports-related injuries.
All right. You just mentioned ingrown toenails.
Yes, sir.
Common ailment.
Oh, yeah.
What causes them, and can they be prevented?
Well, there are a number of different causes. One can be how the foot functions. Sometimes if you're excessively flat-footed or something similar to that, well, that pressure of your foot actually flattening out makes you walk on the side of your foot a little bit more. That can put excessive pressure on the toenail, on the border of the toenail, and it can cause it to become ingrown. Another one is improperly cutting your toenails. Another one can be...
Well, let's stop on that. What happens if you improperly cut your toenail?
Well, if you go and you cut too deep into the nail, you're bound to leave a little sharp edge there or something that can cause injury. And of course the nail is growing tissue, so as it grows out, and if it's a jagged edge way down deep in that side of the nail, it'll just tear the skin as it grows and therefore get very inflamed and usually infected.
Okay. What do we do to prevent this problem?
Well, one is to, when you trim your toenails, to go straight across the nail, try not to dig back into the borders of the nail, because you're more than likely to miss something.
Okay. And once you're presented with an ingrown toenail, how do you treat it?
Usually, in most cases, it's a little procedure that we do in the clinic, which entails numbing up your toe so that you can't feel anything, and then removing that whole side of the nail, about a border that's about 2 to 3 millimeters wide, and getting the ingrown part of the nail out. And that can usually be done permanently where the nail does not regrow by just putting a little bit of an acid in that corner of the nail. This way it doesn't grow back and doesn't cause an ingrown toenail again.
All right. Another foot problem, foot problems, this is a plural. I want you to explain the differences between corns, calluses, and bunions, and tell us what causes each.
Okay. Well, corns and calluses are very similar. A corn would be more like a callus with a central core in the middle. A callus would just be a more broader area of thickened skin. Both of them are related to increased pressure over a structural point of the foot, usually a bony prominence. And when the skin reacts to stress, it responds by getting thicker, and therefore it grows a callus. And then that callus creates increased pressure on the tissue underneath it, usually the nerves, which can cause pain.
All right. Moving on to bunions.
Bunion is actually a structural deformity of the foot, and that is when the big toe starts to head towards the second toe. And it can get so severe that it can actually overlap or underlap the second toe and actually become dislocated. It's basically when you have a muscular imbalance of the foot and one tendon, a tendon that would pull the toe to one side or the other, one tendon gains an advantage, and it usually will pull that toe and pull that toe and pull that toe. Now the bunion is actually when the bone behind it starts to shift because of that pressure from the toe. All right. And that causes that bone to shift, and it looks like it's growing when it's really shifting. And that imbalance causes a big bump here, and usually that requires surgery to fix.
Okay, you mentioned surgery for fixing bunions, but let's go back and fix corns and calluses. How do you treat them?
Well, any place where you have an increased pressure, you want to decrease the pressure. So that can be handled in a couple different ways. One is actually to shave down the callus, of course, and remove the pressure. But two, in the long term, you want to put them in something that's going to control their foot and remove that pressure from that area of the foot. And that can be done with like an orthotic, which is a device that goes inside a shoe and helps to structurally support the foot. And those devices can be made in such a way that it decreases pressure in an area where there's increased pressure. Another way would possibly be surgery to correct the bony deformity or the pressure from that bone that's causing the problem. But not everybody's a surgical candidate.
Okay. You just mentioned shoes. What's the role of one's shoes in causing these kinds of problems, and how do we know which shoes that we need to wear to be good for our feet?
Okay, well, shoes that would be more detrimental to having a bunion would be anything that's like a narrow-toed shoe that's really does not have enough room for your toes. Toes have to go somewhere, and usually the rigidity of the shoe will control how far your toes can move. So if it's a very narrow-toed, pointed-toe shoe, you're going to have more issues with that, causing pressure and pushing the toe to one side.
Would that suggest that bunions are more common in women than men?
Yes.
Okay.
Yes.
All right. So what else about shoes?
Well, I tell my patients there's a number of different things you need to consider when you're buying a shoe. One, the purpose of the shoe, which is going to be work, church, formal occasion, and how much time you're going to be spending in them. I mean, you can make some concessions for style, but it's not something you want to do on a regular basis. Shoes, you should always buy your shoes at the end of the day, because your feet are usually a little bit larger at the end of the day than they are in the morning. So therefore, if you buy them in the afternoon, they'll fit a little looser in the morning, but by the end of the day, they'll fit nicely. So you won't have to wear a shoe that's too tight.
All right.
You should always have enough room for your toes in the shoe. You should be able to get the width of one of your fingers between the tip of the shoe and your toe. Your toe should not be coming in contact with that surface. You should be able to slightly separate your toes in the shoe and wiggle them slightly. If you don't have enough room to do that, then they're too small.
All right.
And you should never plan on buying a shoe to break it in, because usually it's only your foot that's going to get broken in.
All right, very good. Still on the subject of shoes.
Yes, sir.
Ladies, high heels.
Yes.
Impact of high heels on women's feet.
Well, I've actually had a patient who wore high heels every day of her adult life from back in the 60s. And she had worn them so much that she could not wear flats when she would go home. She would have to wear her heels at home. Her Achilles tendon had shortened so much that she couldn't get her heel to the floor. And that's an extreme case, but if you hold a foot in a position like that, your tendons and ligaments and muscles are going to contract and cause some tightness there to the point where you can have difficulty walking right.
All right, athlete's foot. How do we get it? What do we do to prevent it? And can we treat it ourselves?
Well, athlete's foot is actually a fungal infection, and it occurs usually in a dark, moist environment. Your shoe is a perfect environment for it. So if you have very sweaty feet, or if you don't tend to dry very well after you get out of the shower and you put your socks and shoes on, you're just creating a perfect environment for a fungal infection. Things you can do for it are typically to keep your feet dry. So after you bathe, allow your feet to dry off and dry well between your toes. If you tend to be a little sweaty or have sweaty feet, you can use like an antifungal powder over the counter in your socks daily. Other things you can do for it, there are some topical medicines, and if you use them faithfully and how it's prescribed on the package, they tend to work, but in some cases they just are very resistant to some treatments, and therefore you might need a medical, like a prescription strength medicine to help it.
So to say, in generally, we can treat this ourselves, and we might need medical intervention?
To a certain point, but you have to know when it's not helping and when to get help. So if you're not sure and it doesn't seem to be improving after a week or so, or it seems to be starting to get painful or blistering, or there's a lot of drainage or odor, I would seek the advice of a medical professional.
Okay. Other foot issues can include heel spurs, claw and mallet toes. Describe these, what causes them, and are shoes also the culprit?
Okay. Well, as far as heel pain or heel spurs, that's typically a condition called plantar fasciitis. And that's actually can be associated with the spur, but it's actually not the spur that's causing the pain. It's actually micro tears of the plantar fascia as it inserts into the heel. And that is usually a biomechanical issue as well. Typically, we get busy with our lives. We don't stretch as much, or we're not as active as we used to be when we were younger or when we were in school. And we tend to break instead of stretch more. So if we can, stretching and supporting your arches are a good treatment for it. But sometimes, it can get to the point where those aren't helping if some people don't get treatment in time. They'll wait and they'll just try to put up with the pain and put up with the pain and think it's going to go away. And they can reach a point where it can be very difficult to deal with. But with a good regimen of stretching, icing, sometimes steroid injections or anti-inflammatories are often used for this.
All right. Claw and mallet toes.
Claw and mallet toes. Typically refer to those as hammer toes in general. And that's basically when a tendon that you use to bend your toe down or up can gain an advantage over the tendon on the other side of the foot, and so you start to contract. And those can be secondary to, once again, improperly fitting shoe gear. They can be inherited as well, and it can also be a muscular imbalance. Typically, those are handled in a couple different ways. You know, if you're not a surgical candidate, there's some things we can do, like making sure your shoe has enough room in it to actually accommodate the hammer toe so they don't rub, because they tend to, with the knuckle being so high up in the shoe, when your toes are contracted, they'll rub sores on the top of their feet. Another treatment for this could be as simple as having a surgical procedure to actually straighten the toe, which is pretty easily done.
All right. So, taking foot health as a broad topic, what are your recommendations for keeping our feet healthy?
One is inspect your feet daily. When you get up in the morning, when you go to bed at night. If something doesn't feel right in your shoes, make sure you figure out what it is. If you need a different shoe or a better shoe, or if there's something actually going on with your foot. Don't wait for small problems to become big. Have them looked at by your podiatrist, in a timely fashion. Small problems can be taken care of rather quickly, but when they start to get worse or more advanced, they become more difficult to take care of and require sometimes greater measures to fix.
All right.
Especially in the diabetic population where they don't necessarily feel things in their feet.
Very well. Doctor, learned a lot. Thank you very much.
Thank you.